blooms for, you said 2008, it's been a few years. I'm 55. When I started the hormone process, if you will, I was about 46, and my girlfriend had called me and said, oh, Suzanne Summers was on some show, and she's got a book out. And I went, oh, well, I'll get the book. And so I got the book, and I read, and then I got more books, and T.S. Wiley's. I got both of her books, and I was just reading, and more of Suzanne at that point. She was coming out with book after book, so it was very helpful for me. Of course, this is over many years. From that first book and reading T.S. Wiley, I knew I was what they call perimenopausal. And I went to my, let's see, I mentioned it to my GP first, and then went to my gynecologist, and she looked at me and she said, well, that's all smoke and mirrors. We're not going to do any blood tests till you haven't had a period for at least a year. And I was like, oh my gosh, well, okay, you're the doctor. So during this time, I kept reading and getting madder and madder, and finally, I had stopped my period completely and went in, and she did. She tested, and of course, it was just like the book said it would be. And I, from that point, went, well, I have to do something. So I went back to my GP and I said, is there something you can do? He wasn't too sure about it. He said that his sister had just started using progesterone. And actually, I think I did purchase, I was doing some saliva testing. I think I may have gotten that out of Suzanne's book. And purchasing purchased some progesterone cream that I was applying myself. But it really wasn't making that much difference, and I knew from reading all the books that I needed more. So I was having all the, textbook symptoms. I was having the hot flashes. I'd wake up at night, and I'm a sound sleeper. Usually, whatever time I go to bed, if I don't have a big bong alarm clock, I don't get up. Trouble thinking, what they call the brain fog. I was like, oh my gosh, this is it. Suzanne was talking about itchiness and that restless leg thing. I think I wasn't diagnosed with it, but I'm pretty sure it was on its way. I could, I'd get restless and be wiggling my feet, my legs and everything. Itchiness. Off and on, I guess we get itchy, but I was noticing dryness, in my vaginal area. Sex was non-existent because of those things, and loss of libido, I guess. Short temper. I'm a very patient person, and I would notice that I just didn't have the patience anymore. I get short with not just family members, but my workmates. I'm a dental hygienist. I work in a stressful, dental environment, but that's never really, I just kind of go on. But suddenly I was noticing just, being short, I really have to hold myself back even with some of my patients. I never got out of hand, but I noticed that, and I was like, this isn't like me. My hair, I noticed, was drier, and it was as I'm losing my hair in my head, I'm starting to get hairier on my body. I was getting a lot of hair all around my breasts. I thought, okay, the weight thing, it used to be that I could drop off a couple French fry, extra French fries a week, or, just stop from using bread, and just have a, my meal, just drop off the bread, and I would lose weight. But now, it just kind of stayed on me, And I haven't actually lost a lot of weight with this, but I certainly do feel better. And I haven't gained more weight. And I think what I was noticing was I was just putting on the pounds. I think I stopped. Now I have to work at getting them back off, but I'm not, continuing on. One of the other things which was very obvious to me was suddenly I had what they called fibrocystic breasts. And I'd have to go in and get a mammogram every year. One time they thought they saw something and had to do another one on the spot. And then they said, well, no, it's because you've got fibrocystic breasts. And lo and behold, and this was very shortly after I started the basic T.S. Wiley Protocol, gone. They're, nice, pliable breasts again. But they were hard and lumpy. You could feel, and uncomfortable for pressure. And of course the mammogram didn't help that any. Let's see, I think the temper, another problem was the incontinence. I was starting to get a little, I guess you call it stress incontinence, where I would be maybe laughing heartily or coughing, and I would feel a quick release. That disappeared. It was starting, and the hormones, I'm sure, are the only reason that's corrected itself. So basically I was just having all of your textbook symptoms. And fortunately, I found Dr. Blum after going to T.S. Wiley's website and looking up a doctor in Maryland, because I'm from Maryland. And thank God I found him, and he's wonderful, as I guess many have attested to. Very understanding, and really knows about many things, but focusing in on the hormones, which is a relief to me, because I could just see myself slowly getting very, very old and uncomfortable, and it doesn't have to be that way. So I'm very happy that I've been able to get with Dr. Blum and start on the hormones, and they have the Wiley Protocol. There is a difference, which you've, I'm sure, read and know about, but having it done that bioidentical, so it's not just the dosage, but it's the way you use them, and making sure that it is through the skin makes a wonderful, wonderful difference.